Hello, and welcome to my presentation at this virtual ASGCT annual meeting. Today, I'm going to talk to you about a method for improving the cryopreservation of your cells. But first, a bit about Albumedix. With our recombinant products, we are a world-leading manufacturer of recombinant human albumin. We believe we can be your partner of choice due to our many years of producing the highest purity and consistent recombinant albumin on the market. We have over 30 years of albumin expertise and have been producing our products for over 20 years, with a number of partner drugs using our albumin either on the market or going through various stages of clinical trials. Our recombinant human albumin products have a proven safety record with greater than 200 million injections administered to children worldwide. With access to our regulatory support team and documentation, and our albumin and application specialists, we believe we can get you to market fast. Our recombinant albumin products can be used in a wide range of areas, from stabilizing things like vaccines, stabilizing proteins, peptides, and small molecules. Also in medical devices to coat surfaces to make them more biocompatible. And of more relevance to the audience today, they can be used in either stabilizing or within the processing of viral vectors for gene therapies. Or what I'm going to talk to you today about is in the stabilization of cell therapies. I'm going to give you two examples where we've been working with collaborators to improve the cryopreservation of their cells. In this first example, we worked with Excelia and the University of Barcelona on the use of mesenchymal stem cells. In this study, we were looking at the use of one of our products, Recombumin Elite, against a control of human serum-derived albumin. Here we generated a cryopreservation solution using plasmolite, 2% Recombumin Elite, or 2% human serum albumin, plus 10% DMSO. We aliquoted the cells into this solution, did a controlled rate freezing, stored the cells in liquid nitrogen, and then we thawed the cells, diluted them 1:10 in either plasmolite plus the 2% Recombumin Elite or the 2% serum-derived albumin. We then stored the cells at 2 to 8 degrees centigrade and monitored the cells over 72 hours. We looked at viability, but also importantly, the identity and potency of the cells. And I can say straight off that for all of the samples, both the Recombumin Elite and the HSA samples, then there was no change to the identity and potency, and they remained consistent. However, for the viability, we here saw a significant improvement with the use of Recombumin Elite. Excelia have a specification on the viability that the cells must be greater than 70% viable. And here you can see for the human serum albumin control that after 24 hours, then the cells were approaching or below that specification limit. Whereas for the samples containing the Recombumin Elite, then there was a gradual drop-off, but it was much slower than the use with the human serum albumin, such that even after 72 hours, that's threefold greater than with the human serum albumin, the samples were still above the specification limit of greater than 70%. So we looked into this further, and we looked at the percentage of apoptotic cells within the samples. And here, for the HSA samples, you can see an increase in this percentage over the time. Whereas for Recombinant Elite, there is a bit of an increase in the apoptotic cells to begin with, but then it remains fairly level. Again, we delved deeper into this, looking at both the early stage and late stage apoptotic cells. Here, with the human serum albumin, the late stage apoptotic cells are increasing over this time, whereas for the samples containing Recombinant Elite, then the cells remain sort of constant. The amount of cells in this late apoptotic state remains fairly constant. So from that, we can assume that the Recombinant Elite is essentially preventing the cells going into that late apoptosis and dying. So overall, we could say that the Recombinant Elite is increasing the health of the cells, increasing the viability. This may lead to the cells being more efficacious in the product, and maybe even safer as well. So we have published this data together with our collaborators. The reference is here up on the slide. My email will be at the end of the presentation as well. And so if you can't get hold of this presentation, then please drop me a line. So for the second case study, here we did it with the Center for Genomic Regulation, again in Barcelona. In this instance, though, we were looking at iPSC cells. This is an early stage, and we hope to share more data with you later, but we can go through these first couple of studies. So we looked at, in this first study, different levels of the Recombinant Elite together with a number of sort of standard solutions. So we cultured the cells, we cultured them to 80% confluence, then single-celled them, and then generated aliquots that contain 1 million cells per mil, and each aliquot was 1 mil. These aliquots were in these different freezing conditions, so either 2, 10, or 50% Recombinant Elite together with 10% DMSO, MTSAR with 10% DMSO, Plasmolite with 10% DMSO, and a off-the-shelf product, Freezar, that didn't need any additional DMSO. Again, we did the slow ramp freezing, stored them in liquid nitrogen, and then thawed them. We did look at the viability and the potency of the cells, but in this instance, we were very much interested in how the cells then performed in terms of further growth. So we looked at sort of colony formation. So we took a set number of cells for each sample, in this case 200,000 cells, plated them, and then grew those plates up for a number of days, and then counted the number of colonies after that time. So here is this first set of data. The first control, Plasmolite plus 10% DMSO. And as you can see, there was a big increase with the use of Recombinant Elite. 2 and 10% gave similar results, and then a bit of an increase with 50% Recombinant Elite. Here are the other two controls, the MTSAR with 10% DMSO and the FreeSAR. And again, you can see that there is an increase with the use of Recombumin Elite compared to these control samples. We did look, as I say, at the pluripotency of the cells, and in all cases, the pluripotency of the cells was maintained, and there was no difference between the different methods of cryopreservation. So here we can say that the use of Recombumin Elite can improve the colony formation post-cryopreservation compared to standard solutions for cryopreservation. In the second study, we were looking at the use of Recombumin Elite in addition to these standard methods and standard solutions. So we did the same culture conditions, cultured them to 80% confluence, single-celled them, and then aliquoted them in 1 ml aliquots with 1 million cells per aliquot. Here we looked, say, with plasmolite plus 10% DMSO, plus or minus Recombumin Elite, MTSAR with 10% DMSO, plus or minus Recombumin Elite, and then FreeSAR. As I mentioned, that doesn't require any additional DMSO, but we did two different levels of Recombumin Elite at 5% and 10%. Again, slow ramp freezing and storage in liquid nitrogen, thawing, and then the testing of the samples. Again, we did the viability and the pluripotency, but again, we were looking at the colony formation of the cells. Here we were a bit stricter, and rather than 200,000 cells, we did 50,000 cells. And so here are the results. So the number of colonies formed is lower because we took a lower number of cells. But here you can see big increases with the use of Recombumin Elite. So this is with plasmolite. It's plasmolite on its own with DMSO, showing a big improvement with the addition of Recombumin Elite. The MTSAR with 10% DMSO, again showing a big increase with the use of 10% Recombumin Elite. And then FreeSAR, when we just added 5% Elite, there was a marginal gain, nothing much there. But again, with the use of 10% Elite, we showed a big increase in the number of colonies. Again, we looked at pluripotency, and again, all of the samples maintained their pluripotency of all of the cells. So again, we can say the Recombumin Elite improved the colony formation post-cryopreservation when added to these standard methods for cryopreservation. So, to summarize, we believe our Recombumin products, and in this specific case, Recombumin Elite, can greatly increase cell viability and, importantly, the colony formation ability post-cryopreservation. This, together with the general properties of our Recombumin products and us as a company ourselves, we believe that we can be that sort of partner of choice to help the drug developers, help the cell manufacturers, gene therapies, develop solutions to stability issues, processing issues that you may have. So thank you very much for listening. As I mentioned, here is my contact information. Feel free to email me if you would like anything further, or contact us via our website. There should be a couple of handouts also within the system, but feel free to contact me if you have any questions on the use of recombinant albumin. Thank you very much.